You have a patient in the hospital and the treatment isn't going right. The systems are not right. The doctors are making some mistakes. What do you do? Join us in 3 questions with Dr. Umesh Prabhu, a reputed doctor from the United Kingdom who was invited to the Queen's 90th birthday. But first, subscribe to this channel and be sure you click the bell so you are invited to every exclusive premiere we have every other day. Welcome viewers to another episode of 3 questions, and this time we have Dr. Umesh Prabhu from the United Kingdom. He's been the medical director of the National Health Service and now he's helping train doctors all over the world, India, UK, everywhere, on getting more patient-centric, on patient safety. And with that, I'll straight away jump into my first question for you, Dr. Prabhu, which is, about the role of doctors in the area of patient safety. They make mistakes, and in fact, there is a book I've read, Death by Prescription. I'm just wondering, why does this happen and how's the system evolved to that?
Thank you very much, Sandeep. I really appreciate it. It's a great pleasure and honor to be here. And I must give credit to my grandma, Mahatma Gandhi, Nelson Mandela. My values come from them. I was trained in India and I had distinction in MBBS, DCH. I tried for my MD seat. All I wanted to do was settle in Mangalore, where I come from. But unfortunately, India didn't want me, so I didn't get my MD seat. And my friend came from UK. He said, "Why don't you come to UK?" And I came to UK. I had an amazing career.
UK is game.
Yeah, it's an NHS is an amazing institution. I can give you more and more statistics. But it is, as soon as I became consultant, I was very happy near Manchester. I didn't have any ambition, but I made a mistake and baby developed brain damage. I didn't do anything, but I made the final mistake, sending the wrong baby home. 7 things went wrong. There were 2 babies with the same name and almost same date of birth. I had asked for a special X-ray on baby Smith A. My junior doctor didn't realize there was one more baby. He requested for baby Smith B. So wrong baby had the X-ray. But I didn't realize it was the wrong baby. And I sent the baby home, and stepmother was abusing the baby. He stamped on baby's skull. He was an abuser. And that baby developed brain damage. And you can imagine what happens to me as a doctor. I cried for 3 days. Somebody's child developed brain damage. So 7 things went wrong. I put 7 systems in place. And I thought that was the end of it. This was 1992. And within 4 weeks, one more baby died and 3 things went wrong. Nurses, junior doctors made the mistake. I didn't make the mistake, but I developed interest because nobody comes to work to kill somebody unless you are a murderer. There have been murderer doctors also. Dr. Shipman in Manchester killed many patients. He was a psychopath and he went to prison. And there have been quite a few such cases as well. Because I've been collecting them throughout the world. And this is psychopaths. They are just happen to be doctors. So your first question, why doctors make mistakes? It's a human error. Each human being makes 5 to 7 mistakes every day. Each human being. So during their lifetime as a doctor, I see 200,000 patients. So you can imagine, even if I get 99% right, I make mistake in 200 patients.
So in every profession you have them, whether you're politicians, lawyer, businessmen,
you always have bad people. Shakespeare was a very clever man. He says hell is empty, all devils are here. So human beings can be very angels or human beings can be devils. Vast majority. Mahatma Gandhi was an amazing leader. He says don't lose faith in humanity. Humanity is an ocean. Few dirty drops do not make ocean dirty. Vast majority human beings are nice human beings, but they keep quiet because they are too nice. And that's the reason why. I've always said to my friends, nice people must go into politics. Otherwise, politics will be dominated by people who are selfish, who want to make money out of politics. And that's the reason why. When good people keep quiet, world becomes bad. So that is why doctors make mistakes. And what we have to look at is systems. We have to put the systems in place so that patient is not harmed. And that is my expertise, good governance, how to do it. And that is what we did, and we can talk about it.
Absolutely. That's a very important point that you brought out, that they are humans and therefore every human makes those 5 to 7 mistakes a day. But the systemic issues which you're touching upon now, that there is a point I have here, which is very personal to me, because I'm on a crusade against stress. Because Dr. Bruce Lipton, who's an authority in this field, he's an American biologist. He's researched to say that 75 to 90% of the reasons why we visit doctors in the first place are directly or indirectly related to stress. So if we can take charge of our stress and bring that down through, there's a lot of wisdom in the ancient Oriental practices. We may never need to see doctors as much as we do. In fact, 90% of that business would shut down. Here is where I come to the second question, that if we are finding that there is a doctor who's either in a malpractice situation, or he's one of those errant boys or girls in the system, how is the system geared for this? And importantly, what should a patient or the next of kin do in order to get back on track?
Stress is important. I don't get stressed now because with the age I've become smart. I don't get stressed a lot. I learned to relax a lot. I was very arrogant when I was young. Now I become very calm. Even my children find me very boring. I always learn to relax. Because every problem has a solution. If you don't know, ask somebody who knows the solution. And that's the reason why. But most important is, you ask the next question, what should family do?
Yes.
I think that is the most important. I now try to educate people. I think, because it's your health. You are responsible for your health, not the doctor. Doctor can only make you better. But if the doctors make mistakes, you must start challenging them. You must have the courage to ask them. That's the reason why.
But how do you develop that courage? Sorry, I'm stopping you short, because you are so worried as the next of kin, and you are kind of helpless in the medical system. So how can you have the courage to challenge the system when you are at their mercy?
Extremely important question. But you have to ask question to the doctors. If you don't ask the question to the doctor, and that is the fundamental reason why when people don't challenge, doctors feel like God. And that is where the difference is. I always ask people, what's the difference in God and some of the doctors? God speaks. That is what. My cousin spent 22 lakhs having surgery. Surgeon spent only 5 minutes. In UK, you can't do that. You have to go through. You have to take the proper consent. And that is why many overseas doctors make mistakes, because they don't realize the right of patient in UK. Patient have got a lot of rights here. Patient can refer you to General Medical Council. I've been referred twice to General Medical Council by patient. And there is regulation. In India, there is no regulation. In India, there is bureaucracy, but there is no regulation. At the same time, you must not create a bureaucracy, because doctors work very hard. Even in India, I've seen Devi Shetty Hospital, it is Narayana Health. It's a pleasure to go there, because they do so many surgeries. He has brought down the price to a great extent. I've always told NHS, go and work in India, because they do so many operations. And he does 500 cataract operation a day. In UK, we do only 20 operations. So we can learn from each other. We can, that is why I'm so excited with Brexit. There's a fantastic opportunity. And I personally feel doctor-patient relationship is the most wonderful relationship. I always tell doctors, it is a most wonderful relationship. Whereas a woman will undress her, so you must treat her with respect. You must treat her with, that is what is important. You must make sure the patient, you must have a professional relationship with the patient. And when things go wrong, you must be always honest with the family. You must learn lessons. And many families will understand, not every family, because UK spends 1.2 billion pounds a year for medically harmed patients. Wow. United States spends 20 billion. And if you blame doctors for mistake, then they won't be honest with you. He said, that is what I've always said. If you blame the doctors, then they won't be honest with you. You must understand doctors are human beings, and you must make sure, yes, we learn from it, and then only we can improve patient care.
That's so wonderful, to develop a doctor-patient relationship of that level of trust. And that actually brings me to the third question, which comes from a movie that was recently released in 2021. It's called I Care a Lot. And it's about these caregivers and the errant doctors that you were mentioning in a developed society like US, where there is a connivance in the system, and because of which the state is able to not take, they're able to impart the legal custody of an elderly patient to the caregiving organization. And the caregiving organization, since they have the legal custody, can actually misuse that financially, and a lot of high net worth patients are legally kidnapped into old age homes. Now, this was, of course, a movie, but it rattled me because there is every possibility that this could be the way that we are going, with a few poisonous drops in the beautiful pool of water. How do you see this going? Is this possibly can it become a reality given the way that the systems are structured?
I think it's very important point. I think that is what my biggest fear when I have dementia, when I'm not able to make a decision.
Yeah.
What happens to me? Because children are busy with their own life. It's not like India where the children look after their family. And even in India, that tradition is changing. My father and my mother, they are very lucky because my brother is looking after them. My mother had cancer. She died recently. She received a very good treatment. I was able to arrange from here, and we can afford it. But my worry is when you get old, when in a strange country like United Kingdom, and what is happens, who is going to look after you? And some of the statistics are very, very frightening, even in the UK. For example, elderly care, in where I was working in Wigan, 300 elderly patients had pressure ulcers, and they were not looked after very well. And they can't speak. And that is why I've always said we must care for the most vulnerable people of the society. That is what true leadership is all about. When you are young, you don't need anybody. When you are old is the time when you are not able to look after yourself. That is why I like Indian tradition of son looking after, of mother, daughter looking after the family. Many of my friends from UK have gone back because their parents, there is nobody to look after. And that is a tradition which I'm very proud of. We must be very proud of some of the Indian tradition. My guilt is I'm not able to look after my mom and dad. Even when she died, I couldn't go because of COVID. And I cried. And that's why. But my brother is looking after them very well. I speak to my dad every week. And that's the reason why. And that is why my aim, my dream was in UK to make this one of the fantastic care for elderly people, elderly patients, patients with dementia. My brother-in-law was a very good cardiologist in Bombay. Today he has got dementia. My sister's life is completely turned upside down. And I wanted to make sure UK dementia patients get the best care, elderly patients get the best care, because they suffer more due to medical error because they can't make a decision. They are on a lot of medications. A lot of organs have failed. And I personally feel that is what I've always said. We must make sure we provide the best care for elderly patients. Then only we know the art of care.
Fantastic. I am so inspired by that dream that you just shared, and I do hope that it becomes a reality soon. Because, like you said, it is the leadership that has to take care of the system, and it needs leadership like this so that the system doesn't corrupt. And that is so awesome. I thank you so much for these examples that you've given and for opening your heart and experience out to us. You, dear viewers, this is your time to do LCSS. Like, comment, share, and subscribe. And don't forget to ping the notification bell so that every time we premiere a new video, you're notified in advance. Thank you, and we see you soon.
Thank you very much, Sandeep. Really nice talking to you.
It was absolutely a pleasure. Thanks.
Thank you. Thank you.